Okay guys, so for this next part of the correcting low back and knee dysfunction video, hopefully by now we've done those, we've done all our mobility techniques, we've done those activation techniques, we've done those core activations. So hopefully now at this point, your glutes are on fire, they're really working hard. But guess what? We're going to do some more. We're going to get some more glute work done. So we've just done that core activation, that core integration section. Okay, so that we did our glutes, TVA, then we did things like those bridges where we kind of got the glutes and core all working together. And now we're going to add some stability integration as well. So we're going to start bringing this back into more functional movements, but more unstable. So we're going to try and get those deep core muscles again to work with not only the glutes, but then the muscles that stabilize the knee and also the foot and ankle joint. So this can be really, really effective. And it's one of my favorite exercises, the single leg touchdown. Okay, so what we're going to do, we're going to start in this position. Okay, we're going to go on one leg. I'll show you some progressions and regressions, but I'll show you the basics first of it. Again, I've got my second and third toe forward. I'm going to take this back leg off. Okay, and what I'm going to be doing, I'm going to be reaching down with my right hand. I'm going to put my left hand on my pelvis, my left side of my pelvis. And what I'm going to do here is I'm going to slightly bend this knee. I'm going to be driving my hips back towards the wall behind me. And I'm going to reach down as far as I can comfortably. So I'm going to go right down to the ground. And then I'm going to push through the floor, push my foot through the floor, come up, squeeze my glutes. I'm going to drive up. Okay, so I'm going to keep my belly button pulled in. I'm going to come down 1, 2, 3, hold it for 2, push through the floor, squeeze my glutes, come straight back up. I'm going to show you guys on this side. So again, I'm going to take this back foot off. I'm going to do it on the right side. This back foot off. I've got this back foot way back here. I don't want to add so much as a counterbalance. I just want it just off the floor. Again, I'm going to reach down, come down 3, 2, 1. I'm going to hold it for 2 at the bottom. And I'm going to push through the floor, drive myself back up, squeeze that right glute. That time, come back down 3, 2, 1. Slightly bending this knee. Hold it there, push straight back up and squeeze. Okay, so just go to where you feel comfortable. If you feel like you're getting stuck here, you can't go any further, you have to really round your spine, that's fine, just go to your knee. If you can go a bit further, go to your shin. You can go all the way down, go right the way down to the ground. Okay, but we want that 3, 2, 1 tempo, so that 1, 2, 3 down, hold it, 1, 2 at the bottom, drive up for 1 second. If that's a bit too much, if we're really struggling with that, we can make it easier. So you can keep your same setup, but rather than having the foot off the ground, just put it behind you. I normally start people with, I just put their big toe into their heel, keep that back foot on the ground so you've got a bit of a kickstand, and now try it. And normally that's a lot easier for people. If you need to, give yourself a bit more support, maybe bring that foot to the side a little bit more if you need to, and you can do it that way. That's absolutely fine, you can do that. If you want to make it really, really tough, you can also get like an unstable surface, maybe like a wobble pad. You could try one of these crazy half foam rollers, which I could try and do. I'll probably fall off. I normally do it on one that's much smaller, but there you go. You could come down this way, hold it, drive back up again. So real slow. You've got that unstable surface there now. Again, driving back up. So again, you could use that. You could use things like an Eric's pad as well. That's absolutely fine. So that's going to be our stability integration exercises. There's other things we could do as well, but I like the single leg touchdown because it gets not only our deep core muscles that we just switched on, our glute muscles that we've just switched on, but also helps with those muscles that stabilize the knee as well, which would also be our glutes, and also those those muscles around the foot and ankle joint. So we want to get these things all working together when we go back to function, so that we move more efficiently. So hopefully you guys like that. That's our single leg touchdown for stability integration.